Good morning. Today is Tuesday, November 19th. Thanks for tuning in to Buncombe County's community briefing. My name is Stacy Wood. I'm a public information officer for Buncombe County government. Today, Buncombe County Environmental Health and Tetra Tech, the county's recovery contractor, are here today to provide updates. And we also, while the city of Asheville is not here to provide us an official update, they are on hand to answer questions during the Q&A portion after the presentations. And we'll go ahead and get started with the report from Avril Pender, County Manager.
Good morning. This afternoon, there will be a Board of Commissioners meeting. The briefing starts at 3 p.m. and the regular meeting starts at 5. You can watch the briefing. Will be streamed live on the Buncombe County Facebook page. And starting at 5, the regular meeting will also be streamed live on the Buncombe County Facebook page. An update on Parks and Recreation. Parks and Recreation is actively working on reopening as many parks as possible. Currently, North Buncombe Fields, Can Creek Playground, Bang Creek River Park, Hominy Valley Park, and sections of Buncombe County Sports Park are open. We have seen some inaccurate information circulating about the Lake Julian Festival of Lights. Staff are finalizing plans on what this year's festival could look like, and we anticipate having more details by the end of the week. So stay tuned for more details on this event. Also, you might see the department's core van out at Grovemont Park near Beacon Village and the Buncombe County Sports Park in the coming days. Keep an eye out for the core van and stop by for some fun kids activity. An update on FEMA in our county. For those who have not yet filled out their FEMA assistance application, we encourage you to do so at disasterassistance.gov or by calling 800-621-3362. Important updates from the FEMA Disaster Recovery Center at the Asheville Mall. Starting on Monday, November 25th, the center at the Asheville Mall will be open 8 a.m. to 6 p.m. on weekdays and 9 a.m. to 2 p.m. on Saturdays. This center will now close on Sundays and will be closed from November the 28th to December 1st for Thanksgiving weekend. The DRC will open 8 a.m. Monday, December 2nd. This week, the center is open regular hours, so come by 8 a.m. to 7 p.m. If you come to the Asheville Mall before doors are open at 11, use the Barnes & Noble's entrance. This new schedule applies to all DRCs in the state. So if you are out of town visiting another DRC, this is their new schedule as well. So to find a DRC location near you, go to FEMA.gov/DRC or text DRC and a zip code to 43362. An update on the hazard mitigation grant. Buncombe County residents can receive funding to make their homes more resilient through home projects that reduce the long-term risk and impacts of natural hazards such as floods, wildfires, and storms. Through the program, there are 3 home or property projects, including elevation, home mitigation reconstruction, and acquisition. Aspects of this new program include raising the elevation of the home, a new foundation and new construction, and or acquisition of the property. In all 3 of these programs, there's no cost to the homeowner. So far, 582 applications have been submitted for this program. Applications are open now and can be submitted online. To apply online, complete the 5-minute grant information request. The link will be in the chat, or you can also scan the QR code on the screen with your phone. Online applications will be open for a year. An update on storm debris. As of this morning, over 181,000 cubic yards of debris have been collected in Buncombe County. Currently, there are 39 trucks running in Buncombe County removing debris from all zones in the county. The private property debris removal program is active with an official launch of today, Tuesday, November 19th. The online application option is live. We will add the link in the chat, or you can also scan the QR code on your phone. You can also call the One Buncombe call center with questions about debris. That number is 828-250-6100. Again, 828-250-6100. An update on regular household trash collection for this week. For today, Waste Pro will operate normal routes for household trash and recycling. Residents should use the transfer station or landfill if Waste Pro is unable to access your location. For Wednesday through Friday, Waste Pro will operate normal routes for household trash and recycling in accessible locations. Waste Pro will also be located at the following locations for residents they are not able to access from 8:30 a.m. to 3:30 p.m. This is for household bag trash only. Tomorrow, Wednesday, they will be at Hearts with Hands, 850 Warren Wilson Road. Thursday, Ingalls Fairview, 225 Charlotte Highway. And Friday, North Buncombe Pool, 734 Clark Stopper Road in Weaverville. A reminder from the Asheville Buncombe Rebuilding Together grant, that fund is now open. For-profit businesses in Buncombe County and the city of Asheville are eligible to receive grants of up to $25,000 to support recovery expenses not covered by insurance or other funding sources. Applications are open through November 27th and can be found at mountainbizworks.org/AB grants. Applications are also available in Spanish. And again, that website is mountainbizworks.org/AB grants. An update on our distribution sites and community care stations. Even with the city's fantastic news that the boil water advisory is lifted, water distribution operations, laundry, and shower will continue to be available at the community care stations. We are working to coordinate these resources for our community based on need, and we'll be sure to communicate about any changes to the sites. Our community care stations are open daily from 7 a.m. to 7 p.m. As we continue to transition into this new phase of the response, we will begin to provide updates on the work of county staff as we move into long-term recovery support operational framework. We will begin to provide updates on these priority areas and major movement within this framework. And speaking of transition, and in light of the boil water being lifted, I'll now ask Jessica Silver from Environmental Health to provide an update from regulated establishments as they resume normal operations.
Good morning. As part of the Helene response, food service establishments, childcare centers, lodging facilities, tattoo artists, and public swimming pools were allowed to operate under an emergency operations plan while the boil water notice was in place. Environmental Health processed 1,099 emergency operations plans. Some establishments decided to remain closed until the boil water notice was lifted. Regardless of whether the facilities regulated by Environmental Health chose to operate under an emergency operations plan or chose to remain closed, any facility that was impacted by the boil water notice should do the following before resuming normal operations. Flush pipes or faucets, follow the directions of your water utility, or general guidance is best practice to run cold water faucets for at least 5 minutes. Equipment with waterline connections such as post-mix beverage machines, spray misters, coffee or tea urns, ice machines, glass washers, dishwashers, and other equipment with water connections must be flushed cleaned, and sanitized according to manufacturer's instructions. Attention should be given to waterline strainers, faucet aerators, and faucet screens. Run water softeners through a regeneration cycle. Drain reservoirs in tall buildings. Flush hot water tanks. Flush drinking water fountains. Run those continuously for 5 minutes. Water filter cartridges should be replaced and canisters sanitized. For those of you who have ice machines, it is important that you sanitize your ice machine. Flush the water line to the machine inlet. Close the valve on the water line behind the machine and disconnect the water line from the machine inlet. Open the valve, run 5 gallons of water through the valve and dispose of the water. Close the valve and reconnect the line, and then discard the first 3 batches of ice. Once the establishment has completed these steps, you can begin to use the water as normal. Normal activities include cooking, drinking, dishwashing, sanitizer preparation, ice making, the use of fountain drink machines, and diaper changing. Note that many of these guidelines, like flushing the water for 5 minutes, differ from the City of Asheville recommendations for residences. This is because facilities that serve the public and are regulated by environmental health have higher standards to meet in order to protect public health. For this and other information and helpful resources, please visit buncombecounty.org/EH. Thank you.
Good morning. This is John Burry with Tetra Tech to provide an update on some of the county's new community-facing programs. First, I want to brief out on the private and commercial property debris removal program and demolition assistance program. So Buncombe County's property owners in both the unincorporated and cities that have been impacted by Hurricane Helene, who do not have debris removal insurance or have exhausted their insurance, they may apply to be qualified for the disaster debris removal program from their private or small business commercial property at no cost. This program also covers the demolition of eligible unsafe structures. This program was launched on Saturday morning. We've already got close to 100 applications, and we want to make sure we get the word out. So generally speaking, when we talk about private and commercial property debris removal, we mean the removal of hazardous limbs, trees, and other mixed debris that have been caused by Hurricane Helene that are generally near commonly used areas or maintained areas of a private or commercial property. This may also include a removal of debris impacting a waterway. And it could include the demolition and removal of a structure that is deemed to be a health hazard that is unfit or unsafe and may not be recoverable and is a threat of collapse. And this would include or could include the removal of concrete slabs. This program does not include the removal of debris on vacant lots or other unimproved property or a property that's been used for agricultural purposes, such as crops or livestock. This program is not intended as a lot clearing program. So, to apply for the program, a right of entry form, or ROE, that must be signed by all property owners is legally required before contractors who are providing debris removal or demolition services can access your property to even begin the determination process to determine if you are eligible for the program. To apply for the debris removal or demolition of unsafe structures on your private or commercial property, you can do by several different means. Number one, visit the online portal link at onebuncombe.org. That's www.onebuncombe.org. You can also call the One Buncombe call center at 828-250-6100 and select option 2. or you can visit one of the 4 PPDR and CPDR application centers to apply in person. We have one at the Asheville Mall, and that follows the FEMA DRC's hours, which are currently 8 a.m. to 7 p.m. And we have 3 additional sites that are open Tuesday through Saturday, 8 a.m. to 5 p.m. These 3 additional sites are located at Barnardsville Fire Department, Station 15 at 100 Dillingham Road, Swannanoa Fire Rescue at 510 Beetree Road, and finally, Fairview Library at 1 Taylor Road. The county is also going to have community canvassers who are in the community to provide information and help walk residents through the online or electronic application program. These community canvassers may be at some of the pods or CCSs. They may be also attending various community meetings. More information about satellite locations that may be opened will be provided through the county's Joint Information Center. And once again, I want to show the graphic of the onebuncombe.org. If we could please move to that, which is the Helene debris removal. You can see the button right there, the 4th one down, where you can access this. And of course, there is the QR code to access the application. When you apply, we encourage you to have the following documents available: a copy of your insurance policy and proof of statement of loss from the company if you are insured, a color copy of your driver's license or valid U.S. government ID, such as a passport or real ID, a proof of ownership, such as a warranty deed, tax assessment, etc., and a simple sketch of the property identifying the locations of the debris. And this is going to be hand-drawn just to provide some additional information of the nature of the hazards on your property. For any questions about the PPDR, CPDR, and demolition of unsafe structures program, please call 828-250-6100. That's the One Buncombe phone number, and select option 2. You can also visit the website for more information, access our frequently asked questions or FAQ that has been published. We will be updating that as we collect more questions. The second program we wanted to provide information on is the Substantial Damage Assessment Program in the Special Flood Hazard Area. As part of the ongoing recovery efforts from recent storms, Buncombe County has began the process of working through assessing the damaged structures as part of FEMA requirements. Over the coming days and weeks, you will see county teams, which includes representatives from our staff, who are going to be out in the community completing the assessment processes within FEMA's required timelines. And here's what you can expect of these teams as they begin to work in the community. The teams will be assessing the structural damage curbside from vehicles. The teams may take photos of damaged structures from their vehicles or the right-of-way, and in some instances, these teams may be on foot to take multiple photos and record basic information such as the property address. Each of these teams will have handheld electronic devices such as tablets or smartphones to record the necessary information. Each contractor will be wearing a blue vest and carry credentials, and they'll also be able to share a QR code indicating that they are a vetted contractor with Buncombe County. And again, every one of these teams will have a Buncombe County staff alongside. Thank you so much.
Thank you, John. We'll go ahead and open it up to the media Q&A portion of the briefing. As I stated earlier, the city obviously did not provide an update today, but they are here with us to answer any questions you might have for them. With that, are there any questions?
I have some water questions if Clay is available. It's John Boyle at Asheville Watchdog.
We do have Brenna and Ben Woody on the way up to answer your questions. Clay is not with us today.
Okay.
Hey, John.
Hey, good morning, Brian. Good morning, Ben. Uh, I've just gotten multiple people raising concerns and asking questions about the safety of the water. Although this has been going on for quite a long time, they feel like all of a sudden the water was pronounced safe and okay to drink. So I'm just hoping y'all can offer some assurances on that and how this process was done to assure water safety.
I'll take a first shot of that, John. Thank you. The return to potable water was gradual. So we have been, as Clay's mentioned previously, for several weeks, we've been putting water into the North Fork plant, which has been treated. Initially, we were blending that water with the raw water source. I think for a period of time now, we've been putting only potable water into the system. So we feel confident about the return of that treated water into our distribution system. It's just like it was pre-Helene. The other thing that we've done is as Clay's mentioned, we've provided or performed over 1,000 water quality tests. We just did 120 last weekend. So again, all those tests came back consistent with what our regulators require for us to deliver potable water to the community. Last piece I'll say, if you are a homeowner or a business and you do feel concerned about lead, we would encourage you to follow the recommendations we've placed on our website that we've developed in conjunction with the EPA. So again, if you're concerned about lead, you'll need to flush your water for 30 seconds to 2 minutes or until it runs cold. And you should do that at whatever faucet you plan to use.
Okay, and Ben, I had a couple people ask about testing water at their taps. And I think not just for lead, they were wondering if there are tests available at home to test for coliform or some of these chemicals that were used. Is there city offering anything like that?
Our lab is capable of testing for total coliform and E. coli bacteria, but we are overwhelmed right now with the lead test kit request. If everybody starts requesting total coliform and E. coli, I don't know how quick we could respond to those requests. We've also tested all the chemicals that they're concerned about. They are on the website, and we have a spreadsheet of all those, all our treatment process chemicals that we test for is on the website under the raw water analysis and point of entry analysis spreadsheet.
John, real quick, just to add, we provide our customers water, and we do that through a heavily regulated municipal water system. So we have regulators from DEQ and EPA. So again, just want to say, we wouldn't have lifted the boil water notice if we didn't feel confident that we are delivering the highest quality drinking water to our customers in Asheville. And again, we do that meeting all the regulatory standards that apply to us, and the water that we are delivering today is of the same quality water that we delivered before Hurricane Helene.
Okay.
And Brenda's going to add one more note, John.
Okay.
Back to the total coliform and E. coli, part of our requirements is we have to sample the entire distribution every day. We've not stopped doing that through this whole process. Just because the boil water notice is lifted, lab staff still out there sampling at our sample stations every Monday through Friday, and we're making sure we have chlorine in the distribution system 24 hours a day.
Okay, thank you. I've got one more I'll ask verbally, and then I'll put a couple in the chat because I don't want to hog the floor too much. Several readers expressed confusion. This has been explained, I think, but I'm hoping you could succinctly go through it on how we went from needing 1.5 to 2.0 turbidity to even filter water to where 14 and a half and actually even higher than that was okay to filter. It seems like that hinged on the U.S. Army Corps of Engineers testing. I know Clay had mentioned they had kind of a portable system that they were able to determine that y'all could do a higher level of turbidity. Can you make sure I'm getting that right and then explain how that process worked?
Yeah, it's a good question. There's a lot of uncertainty following this storm. It was catastrophic in nature. It turned over our reservoir in a way that we've never seen before. So just to be clear, when we began this process of trying to restore North Fork, we did that. We had to do that in a way that we had never done before. So one of the first things that we did, and I actually mentioned this in some of my early briefings, is we procured what's called a pilot plant. And that's basically a test plant. It's like a miniature representation of North Fork. And what that allowed us to do is to begin testing the North Fork filter system to see if we in fact could place water into that plant that was of a greater turbidity than we thought otherwise we could do. The other thing I think that's helped us with that and being able to introduce water at a higher turbidity is the in-reservoir treatments we've done. So we've consistently treated the reservoir for several weeks now. We've established the curtain, as everybody knows. And I do think that those in-reservoir treatments have impacted the density of that turbidity. So in other words, I think the clay particles did coagulate. My understanding is they are lighter in nature. And so what we've found is that we can put that higher turbidity water into the North Fork treatment system. But what we've also found is we have to do backwashes more frequently. So again, the system's not running as it normally would with lower turbidity levels, but we are able to run it and manage it in a way that allows us to put water in. Again, we are backwashing the filters more frequently. And we also have a degree of confidence because we know that the Army Corps of Engineers is creating a redundancy, and they are still on schedule to have that completed in late November or early December.
A quick follow-up on that, Ben. Is it safe to say that y'all, because you've never been faced with this sort of event and this level of turbidity, that y'all did not know what the upper end of acceptable or processable turbidity was?
I'm gonna let somebody else answer that.
So in the water world, there's all different kinds of turbidity. When the lake was first turned over, there was a lot of mud plus the light clay particles. So in the mud, as been described, our treatment process of treating the lake with alum and caustic, it helped settle out that mud and it just left the fine clay particles. It depends on the type of turbidity you have based on what you can run through a filter. With our system, it being direct filter, you want a lighter turbidity instead of a heavier turbidity, and you want to be able to settle that out before you run it through the filter and cause problems with your filter or cause filter breakthrough.
Lucas Tomei, Carolina Public Press. I have a follow-up question on the U.S. Army Corps of Engineers, that interim pretreatment system project. I had initially thought, now that the boil water notice had been lifted and it seemed like water was being distributed more normally to Asheville residents, that there was no longer a need for that project, but it seemed like you guys are going ahead with it and constructing it. So I just wanted to ask what that system will add now, even though that the boil water notice has been lifted, now that potable water has returned. What will that system be able to do in addition to what's already been done?
The most important thing that system does is create redundancy for our municipal water supply. As everybody knows, North Fork is really the workhorse of our water system. Weather is unpredictable. If we were to have another storm 1 week from now, 3 months from now, 1 year from now, whatever it is, we want to make sure that system is in place, because what it allows us to do is filter water to filter out the sediment in a way that we can make sure that North Fork is always operational. So again, it's just a critical redundancy for our ability to provide water to our customers. And it's just absolutely critical that we continue to make progress on finishing that improvement. And we are very thankful for the Army Corps of Engineers for their efforts at supporting us in that. So I hope that answers your question.
Yeah, so if I were to put that in other words, I guess maybe you could describe it as like an additional safety net or something that could bolster that system in case of future events like we saw in Helene or something like that.
Hopefully that answers your question.
Yeah.
Sorry about the delay. We are experiencing some technical difficulties on our end, but we are back and we have some questions in the chat. Angelica, would you like to go ahead and ask those questions? And we'll go ahead and get
Absolutely.
started.
This is probably a question for Ben. When can City of Asheville water customers expect to begin being charged for their water?
So obviously, water is an enterprise fund, and so it is in fact the ratepayers that support and allow the water system to operate and make necessary improvements. So we also recognize that folks have not had access to potable water. We also recognize that we are still, to an extent, flushing water. We just had guidance from the health department today, or environmental health is an example. There is some flushing to be done before businesses reopening. Right now, what we anticipate is that beginning in December, we will start making meter reads again. So we'll have more detailed information about that in the coming days, but we certainly don't expect to begin billing and reading meters before early December at this point.
I had another water question. This is Gerard Albert with Blue Ridge Public Radio. Do those days without y'all pumping the anti-corrosive through the pipes have any effect now? And the chemicals that y'all were pumping through, chlorine and manganese, did that have any effect on the anti-corrosive at all?
So I'm going to take a initial response to that and then turn it over to Brenna. The corrosion control it was not added to the North Fork system for approximately 19 days. So I want to say that. We never stopped adding the corrosion control to the Mills River system. So there's a little bit of variability in those days. Typically, our understanding is, or my understanding is, that corrosion control can take about 30 days or 1 month to 3 months to reestablish itself. We've been putting the corrosion control in the North Fork system since October 30th. Again, we're going to do another round of retesting at some of the schools later this month after 30 days. And as Brenna has said at previous press conferences, we will test at 30, 60, 90 or 180? 90, 30, 60, 90 days. So we'll continue to test for lead and copper and just to keep the community updated on those results. And again, corrosion control has been in the system since October 30th, and it is already reestablishing itself as it should be. And I will turn it over to Brenna for the part of the question about other minerals in the water.
We do feed sodium hypochlorite. It's not straight bleach, or I mean, it's not straight chlorine, and we do not pump manganese into the system, but we as a treatment, but it was part of the raw water treatment process. As for the sodium hypochlorite affecting the corrosion control or the removal of corrosion control when we weren't, we are not sure of that, or I'm not sure. I can't answer that right now. But that is why we're doing the lead testing. And we will share the results with the customers who participated as soon as we get the results.
I'd like to ask a couple questions. This is Kim King with WLOS. Brenna, there are kind of questions around what your expertise is. Thank you so much. As I understand it from the spokesperson for the city, you run the lead awareness program. Is that right, for the city of Asheville, the outreach and so forth?
Correct.
I sense that there are people who are clearly concerned that while the water has been deemed safe, they're worried about lead. You've even expressed you've inundated with lead tests. Could you delve in for the public a bit and educate us all? Are you concerned that the suspension of the corrosion control could have impacted homeowners' pipes? And could we be dealing with, while the water is safe coming through the treatment plant, we could have some lead in our own pipes, in our homes, in these schools? And when it's said that you're going to do additional testing, I just have a question about, is there maybe more urgency than's needed after 30 or 30 days to go into these schools that were listed? And then the other question too is, I know that you have been asking the public to do testing in their homes. Have any of these schools submitted tests in the past? Have they performed their lead testing that the city has been asking? And I think the list that had lead levels were Oakley, Sandhill, Charles Bell, Glen Arden, Lucy Herring in the city, Hall Fletcher, and a private school.
That was a lot of questions and I lost track, sorry. Can you start with the first one again?
Can you try to educate the public? What is your level of concern for private homes, for schools, in light of the fact that the corrosion control chemicals were suspended for 19 days, and that those who have private pipes, which appears to be the concern, or public school pipes, there could be lead, and while the water has been deemed safe, maybe I have lead that's being leached out of my own pipes because the corrosion control was lapsed for 19 days.
All right, so as part of the lead awareness program, we have always said we do corrosion control to follow the EPA and our state DEQ regulations. It's a way to reduce corrosion control and that lead getting into your water, but it does not stop it. So the part of the lead awareness program is we've always said to flush your cold water lines for 30 seconds to 2 minutes to use if the water's been setting for more than 4 hours. And this is to use if you're using it for consumption. It is safe to wash your dishes, take a shower, wash your clothes in. There's little possibility of lead exposure from those types of usage. As for the
I'm sorry, keep going.
As for the corrosion control being removed for 19 days, we're not sure, but that is why we're doing the testing. That is why we tested the schools while it was out. And the reason we waited 30 days was to see how it's coming back.
Have these schools submitted any prior lead tests? Did they do lead kits?
Yes, ma'am. They participated not through us, but there was a free or voluntary program called Clean Water for Carolina Kids. And they submitted tests to that program, and it's on a website for Clean Water for Carolina Kids.
And just with regard to the fact that the city's being inundated with requests, lead kit requests, is that going to be locally done in your lab here, or are you going to have to outsource, or are you going to have to hire a contractor? When you say obviously that there's been a huge request for this, clearly people are concerned about their residential pipes. And I saw a stat that said 60% of homes in Asheville are older than 1988. Is that correct?
Correct. On the 60% of homes, it could be a little more, a little less. But thank you for asking that question. We are being inundated with lead test kit requests. The people who need to be most concerned are people who are breastfeeding or pregnant or people who have children in the home, and especially homes built 1988 or before. Oh, and it's kids under 6 in the home. Thank you, Jessica. Sorry. So once again, pregnant, breastfeeding, or with children under 6 in the home, and it's homes that were built 1988 or before. Homes after 1988 do not have lead in their plumbing due to the lead ban. We are getting kits requests for homes built in the 2000s, that kind of thing. We will happily provide it, but we want to clarify that there is not lead in the source water. Where the lead would come from is your home plumbing. If you want to help us out, if your home's built after 1988, you can request later, but that is not a major, you shouldn't have as much concern as for people who have homes built before 1988.
I'm sorry to follow up with this, but I just feel I have to ask this question. While the water has been deemed safe and potable, for people that have homes that were built prior to 1988, that have children in the home, that are worried about their pipes in their home. What is your suggestion when as I understand it, it could be weeks before I get that test back and I have children in my home and we want to drink that water from the faucet?
All of the pressing, they can choose to use bottled water, or they can follow the flushing protocol that we provided them, which is 30 seconds to 2 minutes if you're using it for consumption.
Thanks.
We have another question in the chat related to the curtains at the North Fork. Ben, do we expect those to be a permanent fixture? And if so, are they susceptible to freezing, other weather-related events?
So the city purchased those curtains. So we now own those curtains. And so we will use those until the turbidity gets to a level that we are comfortable enough that we can remove them. They won't stay in the reservoir always and forever. So eventually they will come out. When we're able to do that, we'll save those. And I hope we never have to use them again. But if we do, we'll own the curtains. And no, we're not concerned about environmental factors impacting those curtains at this time.
And we have one additional question in the chat. Jessica Silver shared earlier a protocol for flushing for restaurants related to ice machines and things like that. What's the recommendation from the city of Asheville for their customers with residential ice makers, maybe water filters in their fridge?
Britta's gonna.
For water filters in their personal fridges, we suggest that you dump the ice and make 3 changes of ice before you start using it for consumption. And what was the other?
Just what should people do with those ice machines, and should they be following a flushing protocol for similar devices?
I think just running 3 changes of ice should be plenty, especially after they flush their home for 5 to 10 minutes on each level.
I've got one more question for Ben if no one else has questions. Hey, Ben, this was in the chat, but they didn't get to it. I've had people ask me, we've talked about this before, about permanent changes or additions that might be made at North Fork to kind of harden it or prevent another sustained outage. People have asked if they'll look at a different bypass line in a different area, or a heavier duty or totally different filtration system. Have y'all prepared? Is there any kind of ongoing report or kind of, after action report with any sort of, I don't know if wish list is the right phrase, but needs moving forward that y'all would like to see to prevent this in the future?
Yeah, I appreciate that question. Yes, we'll definitely do an after action report. We already have started that, John. Couple of things I can highlight right now is, yes, we are going to explore a primary water main that routes a different direction. We recognize that a key part of redundancy would be to have a water main from North Fork, number one, that doesn't go underneath the spillway areas, and number 2, as much as practical, avoids Swannanoa River Road. That would be an expensive endeavor, but that is absolutely something we're going to look at and begin to initiate, move forward. The other thing that we want to do is, while we are very thankful for the Army Corps of Engineers redundancy they're putting in now to help us with water filtration, we of course, and again, this is already in our capital improvements plan, but we want to proceed a permanent filtration improvement to North Fork so we don't have to use the curtain anymore. A third thing I want to note, this is not North Fork, but very much related. Another thing we're going to explore, and this is already in our capital improvements plan, but we want to make improvements to Mills River and increase the capacity and ability for that water treatment plant to provide water to the system. So we want to increase our production outside of North Fork. We want to make sure that the water that goes into and leaves North Fork is less vulnerable to storms and risk, such as storm-related damage. And we'll continue to after action, and we'll keep developing redundancy measures as we move forward.
Thank you, man. That's all I've got.
I
Thank
have
you.
just one more follow-up, if that's okay. For Brenna. With the fact that the lab has so many requests now for the lead testing, is there any other resource that you could recommend to homeowners or businesses or daycares, for example, where they could hire a private contractor or also expedite any tests? Because I think the turnaround was, did you say 4 to 6 weeks for those tests? What would be other options that people could explore if they wanted to pay out of pocket?
So I'm going to let Brenna answer that. I just want to reiterate to the community, please, we are suggesting that if you have concerns about lead in your plumbing system, please follow our advice, which is built upon EPA's advice, which is to flush the faucet you're using with cold water for 30 seconds to 2 minutes or until the temperature changes. The best thing you can do to protect yourself short term is to flush your water system. Now, I want to go back to a question you asked earlier, Ken. When we did the initial round of tests, we tested 25 schools, childcare facilities, and a residence. 7 of those came back with a detection of lead. We flushed those 7 for 30 seconds. That was it. And 6 of those 7 did not have lead at detectable levels. And just to be clear, one of the schools that was in South Asheville was actually on the Mills River system and didn't lose corrosion control, but it still tested positive for lead. I say that to tell you, if you have water that sits in your pipes for more than 4 to 6 hours and you live in a home built before 1988, you should be doing this in any event. So I'll let Brenna answer about the test kits, but I do want the community to know, please just follow this simple flushing protocol, whether you're in Mills River or North Fork, if you're concerned about lead. If you have, as the health director said a week ago, excuse me, if you have children under the age of 6, or if you're pregnant or nursing and you have concern, please contact environmental health or talk to your pediatrician if you have concerns. These are preventable steps that you can take as a water customer here in Asheville. And I'll let Brenna, let's Brenna getting a call. She's probably getting a request for a test kit.
Sorry about that. I have a 12 p.m. timeline that I have to meet. So to answer your question, and you asked this earlier, but I think we missed it. We cannot run lead test in-house. So we do contract that out. And the lab that is doing that, it takes 4 to 6 weeks to get those results back. You are correct. If they want to reach out to a lab, they need to find a lab that is certified. They can find that on the Department of Health and Human Services website, and it's the environmental science branch. I suggest they use a lab that is certified and really knows what they're doing, not to use at-home test kits that you can order online at Amazon. But that is up to them. It can be an expensive cost, but it is up to the customer if they choose to go outside.
Brenna, Brenna,
Yes, sir.
hey, I'll try to let you get to your 12. Quick question. So y'all have resumed the treatment, the anti-corrosive treatment. Can you state the date that was resumed, and does that take effect immediately, so to speak?
We resumed on October 30th, and as we have stated several times and been stated today, it can take up to 1 month to 3 months for it to take full effect.
Gotcha. Thank you.
Okay. Thanks to everyone here making themselves available to answer questions. Thanks to everyone who spoke at the briefing today. Tomorrow, we will be back at 11 a.m. We will have representatives from Buncombe County and City of Asheville here to discuss floodplain and stormwater related questions. So we will be back again tomorrow at 11 a.m. Thank you for listening and have a good day.